The Regional Security System, also known as RSS, would have deployed its planes to assist the Federation to transport samples collected by the vigorous testing that is being done by the Ministry of Health. These samples would have been transported to CARPHA, the Caribbean Public Health Agency located in Trinidad. The plane would have arrived on island at about 1:30 p.m. thereabout, and such an undertaking is important as the Ministry of Health seeks to decrease the turnaround time in receiving results. I think these activities by the Ministry of Health, the Chief Medical Officer and her team must be commended.
The security forces continue its operations in support of the Ministry of Health in its fight against the coronavirus. This support includes providing security during visits to the quarantine sites and enforcing the 24-hour curfew and social distancing requirements. So far, I must say that we are mostly satisfied with the cooperation that we are getting from the public in terms of observing the curfew. The security forces were out in their numbers as of 6 p.m. last evening in preparation for the 7 p.m. start of the curfew. And I could tell you by 6 p.m. the road had started to look very scarce and bare, so that by 7 p.m. there were hardly anyone on the road who were not supposed to be on the road. So I want to thank members of the public for their cooperation in this regard. However, of course, there would be some persons who would challenge the system, either to see what would happen or just don't care. And I will tell you that to date we have arrested 5 of those such persons. And this is a small number compared to the population, and so I will say a testament to the tremendous cooperation from the majority of persons. These five persons include 3 Chinese nationals, 1 in Cayenne, who were arrested in Cayenne, and 2 in Bastille earlier today. 3 of these persons have since been released and were informed that they will be prosecuted by way of summons, and 2 persons, Chinese national, remain in custody.
We know that this is a time when persons could feel sad, persons could feel anxious, persons could feel stressed. And the Mental Health and Psychosocial Support Committee, we want persons in our federation to know that these symptoms or these responses are normal. However, if they don't do certain things or certain activities to help relieve themselves of these symptoms, then they can end up and have more severe consequences. So, the Mental Health and Psychosocial Support Committee, we have put in place a response for this pandemic. Due to the nature of this pandemic, we have to do interventions from a distance. So, we have started the dissemination of information related to mental health and COVID-19. We have partnered with the St-Kitts Mental Health Association, and together we are creating and posting content on their Facebook page daily. We are giving ideas as to how to cope. So we are asking our federation, persons in our federation, to kindly access the St-Kitts Mental Health the St-Kitts Mental Health Association Facebook page for information on how to cope.
As of 3 p.m. on Wednesday, 1st April, the World Health Organization reports 823,626 confirmed cases of COVID-19 with 40,598 deaths. In the Federation of St-Kitts-and-Nevis, our confirmed cases and our deaths remain at 8 and 0 respectively. To date, 102 persons have been tested, 8 confirmed positive, 45 confirmed negative, and 49 results pending. In our quarantine, we have 34 persons in government facility, while 314 persons are quarantined at home. 8 persons remain in isolation. To date, we have 91 persons that have been released from quarantine. Again, we would like to stress that the community health workers are continuing to work very hard at in-depth contact tracing and monitoring to reduce the community transmission of this disease. Additionally, we would like to stress the importance of persons remaining in quarantine so that they will not allow for the transmission of this disease. Quarantine is for a minimum of 14 days, and these persons are not allowed to interact with any other member of the public for those 14 days. Also, we are reminded to exercise all social distancing and appropriate respiratory hygiene measures.